This month is Colorectal Cancer Awareness Month, and there are new recommendations out for Americans to get screened. We are joined now by colorectal surgeon Mayin Lin. Thank you so much for joining us today.
Thank you for having me.
Absolutely. Can you tell people at home a little bit more about this cancer if they don't know much about it?
Sure. So colorectal cancer is cancer of the colon and rectum that usually begins with precancerous growths known as polyps in the lining of the colon and rectum. And the next question is, what are polyps? They're basically little mushroom-like growths that grow where the cells line your colon, and they can grow over the course of years to become a mass in the colon, otherwise known as cancer.
So can you tell me a little bit about the causes and the risks? How do people develop this cancer?
Absolutely. So, exact causes of colorectal cancer aren't known specifically, but we know that it is a combination of genetics as well as lifestyle. So, I always tell my patients with regards to the genetic component, you can blame your parents, nothing you can do about that. But with regards to lifestyle factors, things such as smoking, cigarette smoking, lack of physical exercise, obesity, those can all contribute to developing the disease. And so that's what we know. It's a combination between genetics and lifestyle and environmental factors.
Can you talk about how common this cancer is, both nationally and here in Iowa?
Yeah, so colorectal cancer is the second leading cause of cancer deaths from cancer in the United States, and it's the third most common cancer overall. This year, about 56,000 Americans will die from colorectal cancer, and we see more than 140,000 new cases diagnosed nationally. In Iowa, it's about 50 per 100,000 cases yearly as well. So it's a pretty prominent problem, and that's why we always advocate for people to get their screening, colonoscopies, and make sure we stay ahead of that.
And we were kind of talking in the break that this is something that is rapidly growing. A new study has come out that people under the age of 55 has increased risk of what they're finding for colon cancer for young adults. Can you talk about that? And what do you think is going to change because of this?
So it is the trend over the last 10, 20 years. We've seen this disease pop up in younger and younger people. We're not quite sure what the exact reason or the reason behind that is. One of the thoughts is maybe because we're screening more frequently now, we're seeing this happen in younger people. But even with the screening being taken into account, this is just something that's affecting the younger population now more than we thought. So previously, the screening age was 50 years old, or I like to say 50 years young,
There you
not make
go.
people feel as bad as their age. But now the screening recommendations have changed to 45 years young. So it's 5 years younger than what we originally thought. And part of the reason is because we're seeing this more and more in younger folks.
Now, can you talk about the importance of getting a colonoscopy? I know a lot of people like to put that one off, but it is important.
Yes, it's very important. And it's one of the things people dread the most when they come to my office. You can just see it in their face, when you walk in the room. They're just dreading the moment I'm going to tell them, I think we need to schedule you for a colonoscopy. So, just for people who haven't had it before, it's a video camera attached to the end of a very long scope, and the scope goes through the colon and rectum, snakes its way through, looks at every nook and cranny, and takes out any polyps that we see. The process of the thought of having a scope, I think, is more intimidating than the actual day itself. So most people dread the prep. We have a lot of different types of preps out there, and most, I would say 9.5 out of 10 people tell me the prep was not as bad as what they built it up to be. And so in most of the preps are very tolerable. 2 small bottles. They even have pills now that you can prep with. So it's no longer the 4 gallons of fluid that you used to have to drink. And then you go in day of, you get good medication through the IV if you're not put completely out. And when people wake up in the recovery, the first question is, did you even do the procedure. I don't remember
Right.
anything. And that's how we want it, because we don't want you to feel uncomfortable during the procedure. We'd like you to come back to continue getting your scope. So most people don't even remember it.
Absolutely, and prevention is so important. Dr. Lin, thanks so
Yeah.
much for talking with us, and thank you for all of your insight. We'll be right back after the break.